Hello, dear friends, and welcome to the International Fabtalks. We are glad and happy to have with us today Torsha Sinha, a psychologist who is also be giving her time and energy at the de-addiction centers and government hospitals and clinics, and she has done a lot of work. Today, she is going to enlighten us as to what grief is. She would like us to know actually what is real grief. She would like to share some case studies with us. And to me, I'm really eager and waiting to know as to what she's going to share. I'm sure you too will be interested because grief is a part of our journey. We may have many joyful moments, but there are certain moments where we feel grief. So let's get to know more about it from our special celebrity. Ma'am, over to you. Introduce yourself and go ahead with the session.
I am Torsha Sinha. I am a counseling psychologist. I have been in the field of mental health since 10 years, but still now there is lot to learn in mental health because there is lot of stigma related to mental health and related to girls also, like regarding marriage, skin color, then menstrual cycles. So I have lot of things to learn, but today I will tell about grief. I have chosen the topic for the New Year session as well because somewhere I feel that death is the ultimate reality of our life. We all have to leave one day, but we do not accept it or we do not know it. Basically, we do not know it. Like people say, sansar ka moh maya. So we are somewhere lost in that moh maya, and we do not understand when death actually comes, or it basically death is very unpredictable. Parents can never No parents can ever understand, means ever think that they can lose their child, and when they lose their child it really becomes difficult for them to live. So death can happen to anyone. It is very much unpredictable, it is painful, and unpredictable events in life, be it death or anything, job loss or a daily hassles of life, when there is a change, we have to face problems because we are not adjusted with the change. But those changes, like the changes in daily hassles, changes in exam routine, or changes in college, school, still we can adjust. But when it comes to grief, it really becomes difficult to adjust. And at the main point, first of all, we do not accept the reality. It's very difficult to accept the reality. There are many fatal diseases, and as I have seen, I was there with my mother since 2021. She was suffering. When I was there with her in a government hospital, she was admitted for GB stone surgery, gallstone surgery. Most of the ladies had their problems because of skipping meals. Their digestive system was in problem due to skipping meals, due to deficits in proper meal intake. Most of the women, my mother was admitted in female ward. So hearing the doctors words, talking to them, I came to know most of them were mainly gallbladder stone operation, or it was something related to liver, or it was related something to cancer, mainly due to. And even the doctor said, you don't take meals properly, that is why this is happening to you. But at the same time, some diseases are curable, but some diseases are not curable. And each and every day we learn things from our lives. It's not that today, because I have been working for 10 years, I know everything. I said that still I need to learn many things, like menstrual hygiene. How can I explain the importance, the concept, and everything? I do not know. Art therapy also I know little bit. So we, in our field, there is lot to learn. There is lot to learn in every field, but I'm not accustomed with all field. But I know in mental health professional, field of mental health, if you wish, you can keep on learning. And after COVID also, courses are offered on offline online, so that is also a benefit for you. So as I am talking about grief, grief and sadness are different things. Sadness is, suppose today you were supposed to go to mall with your friends and you are not going because it's raining heavily, so you are sad or you are upset. You are upset staying at home. You are upset because you did not get holidays. You are staying in hostel, you did not get holidays to come back to your house in December, so you will go in January. But grief is something else. Grief is a profound loss, and your loss is related with with that person who was very say or who is very significant in your life. When we lose anyone very significant in our lives, that is called grief. Suppose at a younger age, when a child loses his or her grandmother, because many a times I have seen children say my grandfather is my best friend, my grandmother is my best friend, and when that best friend goes away, they develop an existential crisis because they do not want to lose them. Today mainly parents believe in nuclear families, and in spite of being financially equipped, they do not believe in more than in like planning more than one child. They say no, 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 one child is enough. But somewhere I feel they have an empty feeling in their mind for a partner of their own age. So sometimes they get the company of their grandparents, aunties, but that is not temporary. And when they get and that person dies, that is called grief, because when we lose that person who was very significant for us in our lives, for with whom our importance, our attachment, our feelings were um, attached, that is called grief. It is a process and it heals within time, but it is different for everyone to heal. We can't say that you are suffering from grief, it's okay, you will be fine within 6 months. It can be 1 year to 6 years also. Or sometimes with some grief we cannot overcome, we just go on with our daily activities, we adjust, but we cannot forget. Like forgive and forget is very easy, but we do not forget, we cannot forget. Like last day I said that one wish, my one unfulfilled wish, I want my mom back. So that is not possible, but I am going with my daily life. If I would have stopped there saying that my mother is no more, I can't proceed in my life, that would be somewhat my foolishness. We have to go, but an emptiness lies within our mind. We may no matter how many whatever you do, meditation or anything, that emptiness lies in your mind forever. And even I was speaking to a girl whose mother also died due to cancer. Doctor had said that no point doing chemotherapy, she will suffer, you will have to bring her, she is only there for 7 months. Even if you give chemotherapy, only 7 months she will be there, not more than that, not a day more than that. So I asked her that what do you think, what happened to your mother, why did it happen? So she said that she often skipped meals for us. She waited for my father to return. Then she also agreed that she lost her mother in 2014, and she said that our good golden days are gone. No matter कहीं भी घूमने चले जाए, इंडिया के किसी भी कोने में चले जाए, हमें उनके साथ हमारी कमी अभी भी रह ही जाएगी. And I see her Instagram post, Facebook post, always she misses her mother. She doesn't hasn't stopped enjoying her life. She shouldn't stop enjoying her life, but she still misses her mother. She still hasn't yet forgotten her mother, because it is not possible. We cannot forget our parents, because they are the only people on the earth who give us unconditional love. And sometimes they cannot give, like you do well in the exam, you will get a chocolate, but that is somewhere they are compelled to do, because children also don't listen. So somewhere they are compelled to do, but then that is also totally not their fault. Then another friend of mine lost her mother due to liver cirrhosis. Her mother was a nurse, so she did not have any problem to understand that she is going through a fatal disease. And her treatment started in Bombay, Tata Medical. Even after doing stenting, 3 years after stent, 2015, doctor said that nothing can happen. After 2012 and 2015, doctor said nothing can happen. Her mother didn't even have any problem to understand that she might go into coma. So I asked her, what did she say? What were her last words for you? She said she asked me to forgive her because she couldn't give me much time. And in spite of being a nurse, her mother had to skip meal for looking after patients. I said that there is time, a particular time like lunch time. So she said, no, always doctors, nurses also cannot follow that. Until and unless the duties with all the patients are over, they cannot follow that. So this is how she used to skip meal. Then she started in 2012, she retired and she started suffering from anemia. After that, liver cirrhosis was diagnosed. We did not get any liver donor. So she expired, and she expired during Durga Puja on 5th day of Durga Puja. We call it Panchami. And before her mother expired, I met her also, but she said my mother is diagnosed with liver cancer. But I really did not know that those were the last days of her mother's life. I said, "Don't worry, keep faith in God. She will recover." But she did not recover. As she told me that initially it was liver cirrhosis, but later on it turned to liver cancer. She has one daughter. She told me that. Can you imagine? My mother went away on Panchami. How, like now also during Durga Puja, I miss her a lot. So this is what, that when we lose our significant life partners or significant relatives, friends, we cannot forget them. We keep on remembering them. There are many small things in life which remind us. Our memory haunt us with them. Suppose you are cooking something, or somebody has cooked food for you, or maybe coffee for you. You can say that my mom used to cook it like this. Or suppose you do something, or you will remember her. So in small things like dresses, or in places, she is there in your memory, she lives in your memory. This is very true, that the person who goes away starts living in our memory very soon, but is not present in our lives physically. So we cannot fulfill our needs with them. Our needs used to fulfill, our emotions were attached with us. We used to share a lot of things with her or him, but now they are no more in our lives. So it takes time, and especially when the death is very unpredictable. Like when a person is suffering from a long time, an old person, when old people suffer for a long time and die at the age of 92 or 93 years, then people don't take much time to heal, because even they knew that one day they will die. But when deaths are unpredictable, when parents lose their children at a young age, suppose a child died at 18 years or 7 years or 23 years old due to any fatal disease or accidents, then it really becomes very difficult for them to accept. It's a journey. You take your own time. In between that journey, many hurdles come, many obstacles come. They feel very irritated, but grief is a part of our life. We all, it's not that we all have to deal with it. Yes, we have to deal, but unpredictable deaths, unpredictable negative events lead to grief often. And when children lose their parents in childhood, like childhood traumatic experience, in floods, children have lost their families and they are sold in childhood human trafficking. They didn't even know. That also leads to grief, and grief often leads to like mistrust also. The children cannot believe anyone, because at a very young age they see that people, like elders, are not doing the right thing with them. Their behavior is not proper with them, so they start mistrusting the whole world. They feel that the whole world is not trustworthy, whereas this is not true. They develop a faulty perception. Like, ma'am, in one movie, Ek Viva Aisa Bhi, the elder sister doesn't get married until her two siblings grow up, because she sees that their relatives have come to misuse her siblings, to take care of, just to dramatize of taking care of her siblings, to gain her property, her father's property, nothing more. So she sacrifices her life, for which her siblings also love her a lot, like a mother. So for her, for this elder sister and her behavior, they do not develop mistrust. But in that case, if she would have got married, then they could have developed mistrust. It also leads to, often leads to personality disorder also, because the children cannot adjust very easily. When we lose someone significant in our life, we generally we generally want a substitute of that person, just like that. And we often feel non-existential, like we suffer from existential crisis. Grief therapy has 5 stages: denial, anger, bargaining, death, acceptance. Going to that acceptance part, to the 5th stage, is really very difficult. I met one girl uh, when she was studying in class 7. Basically they were not Christian, but her father took means accepted the Christian religion, and they were Hindu. So her paternal grandfather said that you have to leave my house. Later on, somehow they patched up, they met, and when her grandfather died, they went to his Shraddh ceremony, and after that 2 or 3 days after his the program, her younger brother died. So like everybody blamed her that why did you leave him, why didn't you tell him that no, you go and sit with your mother, like that. So everybody blamed him. She was her family members misbehaved with her. Her elder siblings closed door on her face. They did not speak to her. So she said that still I have the I have the means I have the expectation. I accept that still I know, I keep expectations that one day he will come back to me. So I said, how will he come back to you? So she said, I don't know, but he will come back to me. And on his birthday, someone or the other comes to me to have a cake which I used to make for him. He was a younger brother. There were three sisters and one younger brother. So I asked her that didn't your parents, like after losing him, did your parents try for another child or did postmortem happen? Because she said no, postmortem my mother did not let happen because he was very young, only 9 or 10 years old. This is why. So like she was, when I saw her, she was 26 or 27 years old. She had completed her masters. Still, she could not accept the fact that, yes, she has lost her younger brother. He won't come back. So, grief is very difficult to manage. We need to take time. When people are in grief, sometimes their relatives, their friends start judging them. Do not cry, do not do this, how can you do that? Being a mental health professional, how can you cry in front of your mother? How can you break down? How can you break down emotionally? But people forget that we were born as human beings, we were born and brought up as human beings, as daughters, as sons. So later on we decided to become mental health professions, but before that we are simple human beings. So why will we have any problem or any deficit in showing emotions? How can I stop showing emotion for someone who is leaving me? I know that the person is not much in my life. My life will fade once she goes away. What will happen? This is, and once you experience grief, or once you are depressed, or once you have gone through an experience, you understand its pains, its advantages, its disadvantages. Before that you don't understand. This is why I selected the topic to deliver speech on it, so that children or whoever are watching my video later on, they don't have any problem to gain benefit and to be strong. Because we are given all types of education, but death acceptance education we are not given, that you have to accept death also. But if you go to old Hindu texts, in that case you can see that death or moksha was taught in Sanskrit.
Yes, dear.
So this is it. And we often means engage in work. While we are engaging in work, while we are doing any work, we may not remember the person, but when we are sitting alone, or when we are seeing anything, or we are talking about something, we come to know, we उनकी बारे में बात हो ही जाती है. So it's very difficult for us to just forget, or just subtract that person from our lives. Forgetting such people is much difficult than forgiving others. One girl used to study with us in class, in our school. She lost her mother at a very young age. And later she also told us how she lost her mother. But somehow we used to feel, and everybody spoke also, her close friends also spoke, that her mother's death was not natural. There was some mistake, some she must have committed suicide or something like that. Though postmortem was not done, we did not ask her. She also did not say much to us, but she told her close friends. So now I see on Facebook she writes a lot of books. To some extent, the books are related to her sadness, related to her mother. Even in school, we used to see that whenever she used to get less marks in English, she used to feel very bad. Though she had an elder sister to support her, she used to work. Her elder sister used to work. Her elder sister was a student of psychology in Rajabajar Science College. She did her graduation and masters from there. But my batchmate did English. She pursued her masters in English, and she write awesome books. I see on Facebook also. So somehow I felt that she also had multiple relationships. She always felt sad. She was very open minded. When my leg had, I had a fracture in my leg, she used to come to our house, speak very nicely. She was very open minded, but I felt sad because I knew somewhere or the other she had a hollow, an empty feeling. Now I understand that losing a mother or losing the precious gem, whoever might be, mother, father, friend, relative, grandfather, grandmother, is very painful. It like when time goes, time doesn't heal. There is an emptiness in our mind that remains for the special person of our lives, and we just keep going on. We do everything because we have to adjust. We have to be like water that can take the shape of the container in which it is filled, so that we don't remain back and keep ending our work. But often I've seen grief stricken people procrastinate a lot, which I did not let to happen with myself. The day my mother expired, I next day I went to give an interview. After that, I started my work. Everybody was a bit shocked. I said that no, when I'm staying at home, I'm remembering her, because even in her last day, sometimes she used to come to open the gate. Sometimes she used to call me to say, what will you eat? Sometimes she used to call me and said, please come back home fast. मुझे अच्छा नहीं लग रहा है. So I'm not getting any calls from her. I will not get any calls. But whenever I'm outside home, I'm missing her less. At the moment I'm getting inside my house, I'm started missing her. So better to keep on working there rather than sitting. Yes, I won't say that if you sometimes you emotionally break down, sometimes if you cry and remember your significant person, it's not wrong. We all remember them. We can't stay without them. Life becomes difficult. There are ups and downs in lives, but it goes on. Like when I was in a school, I heard many children saying their mothers have gone. So I asked them, what had happened to your mother? One child said, I don't know. I remember her face. She came to me when I was studying in class 3 to give puja, Durga clothes to me for Durga Puja. She said that she still gives me. So I said, can you contact her? She said, yes, her number is with my father, but she can't come back to my life because she has got married and she already has 2 kids. When I met her father, he said that though I was in a um, private farm, my income was not sufficient. She wanted another child. I couldn't give her. But now I'm working as a I'm working in a government job. I'm doing a government job, so now I'm capable of taking one child. But that point of time, I was not. So she left us. But her father also said that she did not create any drama. She just said that give me a divorce, I can't stay. And she did not take the girl child also because she said that I'll come to meet, but I don't. Um, I will remarry and I will not be able to take care of her. The girl developed many symptoms. She was emotionally very sensitive. She had tried to commit suicide eating sunlight powder. She said that I don't want to live. Later on, she was doing well after taking 3 4 sessions with me. I told her father that let her contact with her mother. If her mother as she said that she doesn't want to go to her mother's house and stay, but if she keeps in contact with her mother, that will also be fruitful for her. So her father said, okay, let me see, I guess she will talk, because she often comes when my daughter is not at home. She comes and gives clothes for her, gifts for her, and goes, but she doesn't know that her mother gives her. And one sad event also happened with her, that her father remarried for her. Her stepmom was also very good until and unless she had given birth to a boy. So after that, she said to her husband, now that you have two children, you will not take care of me. So I guess we should separate from them. We should stay separately and let the children stay with their grandparents and paternal aunt. Her father said no, and next day she left the house, leaving her child behind. She doesn't, so she said that, ma'am, my stepmother, I did not have any complaints with my stepmother until and unless she left. She did not want a child. She did a child for me. I said I feel lonely, but I did not know that this would be the consequence. She would leave the house. She said that she was very concerned with me after I went home. She used to feed me. She said that why does she stay in hostel? But I was feeling very tired, so she used to take me every Friday to home, and I return on Sunday. So every time, like whenever children face grief or lose the significant people in their childhood, the next substitute person they get, or if they get, or next person whom they want to trust, is not exactly the person whom they were trusting. So at this point of time, the trust gets hurt and they develop non-trustworthy feelings towards the world, which leads to a faulty perception. Then they cannot trust anybody. But they, at the same time, they cannot think that if I trust someone and he or she breaks my trust, what will happen? What will happen if I trust someone? Max to max, max to max, that person will break my trust. So that is not my fault if somebody breaks my trust. It is his or her fault. His childhood experiences were also not positive, so he broke my trust. Sometimes it's very lucky when people break your trust. But as I said, it leads to a faulty perception. You might not be non-trustworthy with someone, but a small issue can make the person feel that you are being non-trustworthy or the world is non-trustworthy. They do not develop that mature feeling or mature attitude that, okay, if she is not going with me, if my mother is not going with me, I can go with someone else. They do not develop alternatives to their problems, like alternate solutions to their problems. They always they always feel that, okay, fine, she has said, so she has to go. Or if someone asks to them that what has happened to your grandfather or grandmother, they reply with great like anger issues. They develop anger issues for which their parents do not take them for counseling, and they also behave harshly with them, very harshly, but which is not tolerable for them. Rather, they need love and parental care, affect from their parents, which is not available to them or which they do not get. And that deficit in them leads to not only non-trustworthy feelings, frustration, aggression, non-supportive home environment, dysfunctional family, I won't say, but when your home environment is not supportive for you, not enough supportive for you, it then that makes the person feel that when I'm not safe in my home, how can I be safe in the outside world? Sometimes people say that yes, my home environment was not supportive, but that was not their fault. My father earned as much as he could. My mother also worked hard for us, so they understand that yes, our parents worked hard for us. But at the same time, if parents are not cooperative, they do not understand their children after they experience a grief, if they do not understand the child is grief stricken, it really becomes difficult for the child to deal with the world. They start developing issues everywhere, be it in school, be it in home, be it in other children, people's lives. They may develop symptoms which may look like symptoms of externalizing disorder like conduct disorder or ADHD. But basically, underlying depression is also present. which we can find out after we talk to the child. When a school or when an environment is changed, suppose a child sees his father hitting his mother, physically and verbally abusing him, his paternal family members support his father, he may develop the same attitude like his father or a disbelief towards his father. After that, when the child is shifted to his maternal uncle's home, there also he may see that they are not supporting his mother because she is not earning. There also he becomes grief stricken and depressed, but he doesn't show it. Either they show internalizing disorder symptoms or they show externalizing symptoms. But at the same time, the child should be taken to any mental health professional for treatment purpose, which they do not get maximum time. Grief or death of a father before a child is born. When a child doesn't see a male child, when boys don't see their fathers, they do not understand whom to identify with. They may see their mother for some years. She is unmarried. She remains as a widow in her paternal in her in their paternal house. But somewhere or the other, she needs a marriage. So she gets married. The either the boys are taken to their stepfather's house or they are left in their maternal or paternal house. So they feel that when my mother didn't think for me, how can other people think for me? How will I believe the other people? This is a problem of grief when children lose their biological parents at a very young age or before their birth. So this is also means very sad that in spite of being innocent, the child has to suffer a lot, and later on they develop trust issues, personality disorder, and the full life changes. Their full life changes. So grief happens in everyone's life and we have to know how to deal with it. If we remain grief stricken for a long period of time, our daily activities will get hampered, which is not fruitful for us. So we need to deal with grief. We have to learn to deal with grief. We have to learn to spread awareness with grief. Even in schools, many a times nowadays awareness programs are happening, but somewhere I feel that those children who lose their parents before their birth, their life becomes very sad. Not always. I remember one girl studying with us. She was very mother oriented. She did not see her father. He died due to cancer before her birth. Her mother used to feel very sad. She used to live in her maternal uncle's house. Her mother was earning, but she did not remarry. But anyhow, our batchmate also said that my mother at times become very agitated seeing my mummies. It might happen, but she said that she had promised my father that she will not remarry just to see me. So that is also a sacrifice from the mother's side. But often stepmothers, stepfathers are good, but sometimes means I was thinking that they might, if they do not have any children, it's okay, and if they have children from the second husband or second wife, then that might create a feeling of non-trustworthiness in the children's mind, that what will happen if they start loving my younger brother or younger sister. Or if they develop they might develop sibling rivalry, also jealous feelings, if they are because already they have lost someone, and with great difficulty they had started to believe a person. When another child comes, it's very obvious for them to think that will my mother love me more like my sibling, or my sibling is not only my sibling, he or she is my stepfather's son or daughter. So my stepfather will love my sibling, my half sister or brother, not me. And it also happens, these words are not always wrong. It also happens once the child from the second stepmother or stepfather comes, they start taking care of their own biological children more than their adopted children. And in our culture, Children are not kept at homes, or orphanages are also not very good. They do not give the home situation, home environment to the children. Children are kept in great restrictions. So that is also a problem, I feel. But anyhow, I want to say that we have to learn to fight with grief, because it will come to our lives in any form. Always, it's not necessary that it will come in the form of death. It can come in any form. So, ma'am, whenever like people or children are grief stricken, they should be taken to a mental health professional.
Yes.
Elders not only can be grief stricken, children can also be grief stricken, but they might not express their grief. They might not understand. But when they will speak to a mental health professional, they can open up their mind. Like what happened? Why? What happened to your grandfather? Who stayed in your house? How do you like now? Then they can open up slowly. Okay, ma'am, now you ask some questions.
Yes, dear. Dear ma'am, I'm really grateful today because you shared a wonderful topic, which many of them wouldn't have come forward to speak about this topic, grief. And I had this question in my mind at the start when you said death causes grief. Losing a loved one forever causes grief. But at the same time, after a few minutes, you shared that apart from death, separation of parents or violence
Hmm.
at home, or what, there may be several reasons or several factors that could cause a lot of grief. And so I was
Hmm.
happy when you shared the second half, because there are
Hmm.
many questions that were in my head, because I've seen a lot of children who have the parents being separated. As
Hmm.
you've given one example, the mother wanted to remarried and had children of her own. So I was thinking that also causes a lot of grief, and you really very well explained, and you shared with lots of case studies and lots of true examples. So I'm really blessed to have you here today to share that. Much appreciated. Now, ma'am, there's a question in my mind that comes up. Now, how to deal with this grief? You've dealt it very well. You said once your mother passed away, the very next day you attended an interview and you kept yourself busy. You didn't want to have her, you didn't want to feel that she's missing. You wanted to
Hmm.
give your time and be busy and keep yourself occupied. As you said, no, she called you and she would come and she would open the gate for you and
Hmm.
ask you to eat your food and take care of you. So you missed all of that, but you managed your grief very well. Now, could you give us some other tips as to how to manage our grief? It could be either
But first of all, I would like to say elders might not have any problem to understand that they are grief stricken. They
yes,
might not understand that they are grief stricken. They may have problems. They can come and talk to a mental health professional and say that after my brother's death, I'm having these problems. My parents are also not working. They were old age. They are geriatric patients. They have also lost their son, so their problems have increased. I am also having problem with my daily life activities. I can't do them properly. So we can understand the person is grief stricken, because like we as patient, any patient cannot, even if I am having pain in my hand, I will just go and tell the doctor I'm having pain in my hand. I will not tell him in medical terms. Whereas these pain and doctor, these terms are also layman terms. So I feel whenever a person is experiencing any type of difficulty in life, whatever the cause may be, should immediately consult a mental health professional.
yes, dear.
Like one of my patient lost his life in COVID in 2021 during 21 in the month of May or June. So he went, he was having means gastric issues, because he was skipping meals. He did not like to eat. So he went and spoke to a gastroenterologist. So he said that in our chamber, there is a psychologist. She will do your treatment. You need her. You do not need my help. I will suggest you to talk to her and do some exercises, meditation, so that your gastric issues are solved. I don't want to give you any medicine. You do not need now. You need help for your mental health. Your mental health needs enhancement. Hmm. So when he spoke to me, he said everything. After 2 weeks, I asked him, "How are you feeling now?" So he said, "Yes, I am feeling good. I want to join job." Actually, they were like they did a love marriage, and the girl was orphan. She used to stay with her masi, and the boy had lost his father at a very young age. So he used to stay with his mother and masi. So he said that we were planning. I had only planned and told her that let's bring your Masi also to our place. so that she doesn't have to stay alone, because her son did not look after her. He stayed far away. He he helped his mother financially, but he did not bother to come and to call. He was very busy. He was a doctor, a PhD scholar. He was staying in abroad, and he said that my wife did not die due to COVID. She was suffering from COVID. She was kept in ventilation. She developed pneumonia and she expired. So, and he said that I had to take off from job because I was not being able to concentrate. I developed gastric issues. I vomited in office. So my office colleague said that you take some rest. So I felt that I should go to a gastroenterologist. This is but I really felt very good. I did not speak to the gastroenterologist, but I really felt good that instead of remaining stigmatized, he did not have any problem, or he did not even think twice to refer the patient to a psychologist. He This is how we all should work, that you are having gastric issues, but the main root cause of your problem is related in your mental health, is because you have lost your loved one. You have worked together for lots of years. Both of them had joined their jobs on the same day. Interview they had given on the same day, cracked at the same year. So lots of memories he had with her. He said that I don't even have a child whom I will see and spend my day. So this is means after so this is how, and he also agreed. He did not disagree to talk to me. He immediately took my number from my chamber. I was not going due to lockdown, so on call online I used to treat him. He said that if you can do online right now, I don't have any problem. I told him that see, this is a lengthy process, it will go for 2-3 months. So he said, ha, fine, no problem, I want to adjust with my life, I want to join. Because she always used to say, you go to work, why are you doing like this? On the last day also she said that go to work. But I feel sad that she did not die due to COVID. She died due to pneumonia. I told the doctors not to shift her to ventilation, but they said they have no other choice. So today I feel if she was staying in non-AC ward, she could have survived.
Yes, dear.
So this is how we should work.
Yes, dear ma'am.
A person might not go to a mental health professional first. They might go to any physical physician or some other doctors. But if they refer to mental health professional, then that is the best thing. Or if any children are suffering from grief, and their school authority say to their parent that go and meet a mental health professional, that will be also very much beneficial.
Yes, yes, ma'am. I just had the same question in my mind, but you answered that before I could ask you. Like schools and the school managements, the teachers and the caregivers at school, they should identify children who are grief-stricken, who are not performing well, who are calm, quiet, lost in class, being the last bencher, sleeping in class. The teacher should give focus to that particular child and try to seek some psychological help for that child or counseling from the right kind of people.
Yes, in that case, ma'am, I feel that each and every school should keep counselor, and before all small children do not identify their problems. So
Yes.
you need to speak to their parents. So to identify children with any type of problems, I feel awareness programs of counselors with teachers are very important, so that the teachers do not have any problem to identify them. Because what happens, like we know that this person is behaving because he is having this disorder, or this child is getting irritated because of this root cause, but teachers don't know. And there is one teacher, the ratio of teachers to children is 1 is to 30 at least. So when she is saying that do not talk, and she is handling at one time 20 to 30 children, it is also not her fault to get irritated. So if she knows who is a problematic child, and there is a counselor who can help the child, and on behalf I'll also be helped, that is very fruitful for the whole school, I guess. And school should also meet or keep meetings for parents and counselors, so that counselors can talk to them and tell them about the symptoms, how to identify regarding identification, that how will you identify your problem is your child is in a problem. Getting inattentive, not keep distraction, reduced focus is okay with children, but we need to tackle them because it is not a very healthy symptom for your children, for any one of us.
Yes, dear ma'am. Yes, dear ma'am. Thank you very much, ma'am, for sharing all of that. Much appreciated. Looking forward to many more interactions. I'm really grateful that you've given your time. And this is the topic I was waiting to focus on this, the children, how they are grief-stricken because of various factors in their life. Maybe it could be death or parent separation or sibling rivalry. It could be any of the factors, and as well as the elders too, the adults too. Much appreciated, ma'am. I was waiting for this for a very long time, and today you surprised me and you've given all of that that was in my mind. I want such healthy conversations, and I want the right kind of people to present this topic, and you've done
Okay,
justice to
ma'am.
this. You've really done justice. Thank you
Thank
very,
you.
very much. Looking
Thank you,
forward to
ma'am.
many more interactions. Bahut bahut dhanyawad, ma'am. Thank you so much.
Thank you. Thank you.
My dear
Okay.
friends, with this, we come to an end to the International Fab Talks. We'd like you to really understand the importance of grief, what ma'am has shared. Try to watch the video once and get to understand the depth of how you could relate to this beautiful session, as to how you should identify grief in yourself or the people around you who you love. And if you like the session, my dear friends, like, subscribe, and share it with your friends. Let it reach far and wide. Let people know that, yes, it is okay to meet a psychologist. It's okay to meet a counselor and to get mental health, counseling, and to, protect people's mental health. Just like you rush to a doctor for any physical ailment, you also should rush up your children or the loved ones to a psychologist or a great counselor. You could also reach out to Torsha ma'am. She's from Kolkata, West Bengal.
Thank you, ma'am.
Thank you, dear. Thank you.